Hi guys, I just wanted to make a video to update you on what's going on with my progress from my total joint replacement surgery. If you haven't seen any of my other videos, I just want to let you know that first of all, I have some short clips and those are not very exciting or informative. Actually, I only made them to show my family. My phone wouldn't let me send actual videos, so I uploaded them to YouTube and that was that. But I realized that I was getting a few views, and I realized that by doing an actual video, I could, have progress that I could look back on or hopefully share with other people, and that's what this has become. So again, if you haven't seen my previous videos, some of those are just short videos showing how my eye looked after surgery because I had the facial paralysis, or how my opening was, or my swelling. And then the video that this one kind of follows up from is my 1 month post surgery video. So from there, I just want to let you know what's going on. And there's been a lot, obviously, now that I'm about 6 or 7 months post surgery. So forgive me if I look down a few times because I've made a few notes so I don't leave anything out. And I still may leave things out because, like I said, there's a lot. Okay, so, well, first off, as you can tell from the first video, I can open more. That's the number one thing. Prior to my surgery, I could only open about the size of placing your thumb into your mouth. When I would do physical therapy, that was the best way to kind of gauge my opening. It was like a visual for myself and my therapist. So before, like I said, I could do this about that much, and it was about 14 millimeters. And my last video, 1 month after surgery, I was opening, I believe, about 24 millimeters right after surgery. And I was getting to about 27. And now I am about 36. So just to show you, this is really exciting because I've been dealing with this pain and not being able to open for about 4 years. So, like I said, that's the number one thing. The other is the facial paralysis. As you can tell, what I think, I'm back to normal. If you didn't see the other video, I had Bell's palsy, basically. I could not lift my eyebrow. My face was numb, probably about 85% of my face. When I would see the surgeon, he would do the test where he would show sharp or soft with my eyes closed, and I couldn't tell the difference, or I couldn't even feel that he was touching me, especially in the area down here, because I also had sagittal split to the lower jaw to fix my bite. So with that being said, I do still have numbness and pain. I'll get to that, but numbness in this area, as well as from about here all the way up. And you can also see that this is a little bit of swelling. Okay, so another part of what was going on was with the paralysis, I could not close my eye. And that was actually nerve damage. Not everyone experiences nerve damage from a total joint replacement, but I was part of the percentage that does. I could not close my eye. In the previous video, you can see that. But just to explain, I literally could not close it. If I did try to force close it, I was still not able to close it all the way. I mean, you could see the inner corner was still open. So to shower, to sleep, I had to patch it closed. I would literally have to force my eye closed like this, put a patch over it, tape it, and that's how I took a shower or slept. And still I had a fear of like water getting into it. Because I did take showers before realizing I would have to tape it closed, where soap would get in my eye, and it is excruciating. If you've ever gotten like soap in your eye, but it was like an open wound, so it was really horrible. So the reason why now it does close is because 3 months after the surgery, so yes, I did go 3 months with dealing with the eye not closing. My surgeon and I did decide that I needed to go and have surgery on my eye. So what happens is they place a weight into the eyelid, and the only material they can put into the eye is platinum or gold. That sounded really strange to me when this was explained, but gold was placed into my eye. It's very small. It's probably about the size of my pinky nail, and it has 3 holes, one in the middle and one on each side, and that's where the sutures go to connect it to your eyelid on the inside. So if you can see, there's a tiny little scar, and that's where it was placed. There are other options as far as surgery for the eye, but this was the best for me. You can look them up. There are the other options. There are springs and other things like that. Like I said, this was the best option for me. So as far as that surgery goes, it's inpatient, but it felt like real surgery. I mean, you go in, there's pre-op, and you get the sleepy juice put in, but it's almost like Twilight because you are awake during the surgery, which is really terrifying. It was to me. You're put down on the table, and they actually strap your arms down because, like I said, it's Twilight, so you're not really put out completely, and your eyes are open for everything they have to be, and they put in this, it's like an eye drop, but it's a gel, a numbing gel kind of eye drop. So when it's been put in, it feels like you have like a glaze over your eyes. You can see, but it's a really strange feeling. So I guess having your arm strapped down is so that you don't, touch your eye. I guess your instinct would be to kind of rub it. And I remember trying to open and close my eyes to get rid of the blur, So that was a strange part of the surgery. And you hear people talking, they're talking to you. It's a room full of people, they're joking and laughing. You hear all of that. They're playing music. If you've seen Grey's Anatomy, it's exactly like that. So that was kind of odd, but in a weird way, calming. You don't feel anything. You don't know that they are cutting into the eyelid. You don't know they're placing it in or suturing. You don't feel anything, except towards the very end, I did feel kind of a tug. And I was very anxious during the surgery, and they noticed that, so they did sedate me a little more. And it was quick. It didn't take long. I think it was only about 20 minutes from start to finish. And then after the surgery, it normally would be a very quick recovery before they let you leave. But for me, I mentioned in my last video that I do have epilepsy. And also, with my jaw surgery just 3 months prior, I was still in a lot of pain with my jaw. So as far as that goes, from being in this eye surgery, I had clenched my jaw a lot. So I was in a lot of pain with that. And then with the epilepsy, they wanted to keep an eye on me a little bit longer. So I was there maybe an hour, maybe about an hour, hour and a half after the surgery. Excuse me. And then everything was fine, and I was able to leave. When I got home, everything felt normal, felt fine. I was just tired. I slept for a while, and when I woke up, I looked right away. I did after my jaw surgery too, and you probably would as well. It's like the first thing in your mind. How does it look? And I didn't really mention that in my last surgery my last video about the surgery. And I'll tell you, when I first looked, it was in the hospital right after. And I didn't look much different. There was a lot of swelling, and I may have mentioned that my lower lip had swollen so much. It had looked like a bee sting, I guess, if you were allergic. I mean, it came out about this far from my actual lip. So that was the first thing I saw. And that was the only thing that was really different. Obviously, the swelling kind of came later. With this surgery, my eye was slightly swollen. It was closed down a little bit. But I felt okay, just tired. So when I woke up and saw it, it had swollen considerably. Within about another, I guess at this point, maybe about 24 hours, it was bruised. And by the end of the second day, it was swollen completely shut and bruised as if I had been punched. But I will tell you, the doctor told me ahead of time that some people swell up completely. Some people end up having black eye across both eyes, even if they've only had the surgery on one eye. So I consider myself pretty lucky. It wasn't terrible. My eye was watering a lot and I could barely see, obviously, because it was closed shut. So that was the worst part. I had to put an ointment on it and we patched it when I would go to sleep. It was uncomfortable to sleep, but they did prescribe pain medication. So that helped, and I was fine to, get in a car and drive or do things, I would say, within 3 days. It was swollen and I was uncomfortable probably for about 10 days total. And even at that point, I was a little discouraged still because there was no change. My eye still wouldn't close all the way down. And there was still some remaining swelling. So, I was a little discouraged, and everyone tells you, give it time, it takes time. And that was with the jaw surgery as well. And at 3 months, I was still having pain. There was still swelling in my jaw. I was still having problems with speaking. I didn't have full opening as I do now. So I know people are trying to be nice by saying, it takes time, hang in there, and that's nice. But I'm just telling you from my point of view, from someone who's going through it. And if you have gone through it or are going through it, you know firsthand, it's not as easy as, okay, yeah, I'll wait it out. It's going to be fine. It's really hard. It's really hard. But I did have that done. And as you can see, I can open and close fine. In my other video, I did show that I couldn't close casually, and I couldn't even close by forcing closed now. But now I can open and close normally. I don't have any issue with vision or sleeping, taking a shower. Everything is back to normal, I would say. Before the surgery, the doctor told me that patients just know when it's time to remove the weight. Some patients do want to remove it and some patients don't. It could stay in there forever, he said. So I am now 3 or 4 months after that eye surgery, and I can feel it. It's really strange. It's as if when I go to close my eyes, especially if I'm tired, I can feel that the left eye closes further down or is quicker to close. So I guess that's the feeling the doctor was talking about. But it doesn't bother me where I feel like I have to have it removed. So I may leave it in because I feel like another surgery, if it's not necessary, I don't really want to go through it. But we'll see. And I'll keep you updated on the progress or how that goes. Okay. Sorry. Okay, well, going back to how things are after the jaw surgery. Initially, I had numbness from right above the ear all the way down to, right above the ear to below the jawline. And then I had numbness that went to about here, and then numbness that went here all the way up. So I couldn't feel my lip all the way down through here. Like I said, about 85% of my face was numb. Now what's going on is I can feel it to the touch that I have numbness in the same area, and then I have pain even that comes from my scar. It's not all the time, but sometimes when I touch it or my clothes hit it, there's a pain. And then now from here, and this is very painful when I touch, it's from here, I'm not going to touch it, to about here. And like I said earlier, that's due to the splitting of the jaw to bring it forward. And then I'm still numb a little bit through here. Everything else is fine, so that has recovered. I saw the surgeon 2 weeks ago, and he explained that it's just going to take time. And it's nerve damage that is trying to repair itself. Now, a month after the surgery, he did prescribe Neurontin for the nerves. When I went to him 2 weeks ago, he increased that dosage. And already within those 2 weeks, I have felt a difference. Up until then, even my hair touching my face was excruciating. And I don't know a better way to explain it than to say it's like a surge of energy that just hits my face. It's like a zing of pain. I've heard a lot of diabetics say that, they have that feeling in their feet or their hands, or maybe like a restless leg syndrome, something like that, but not exactly. Like I said, it's hard to explain. Not everyone experiences this as well, but just to let you know, this is a possibility. So then I also saw my neurologist because of the epilepsy, and she explained that because it works with the nerves, it also can work towards my epilepsy. Now, this is kind of a side note because it doesn't involve my progress from the surgeries, but this is kind of a complication that I'm dealing with that kind of is working against my healing, I guess you would say. But this is where I am. I have increased my range of motion with my jaw. I can open further. I can slide my jaw from left to right a little better. Not very much, but it's enough for me to know that it's getting better. The orthodontist put in a tighter band, which I don't have on right now, but it goes from this tooth here to one in the back on the bottom, and that's to bring my upper jaw over to the right a little more because my bite is still off. And hopefully, he said, within a few visits, maybe my braces could be taken off, and that is very exciting. So my jaw, my bite, all of that is still off, and when I speak, you can see that. But, like I said, I can move from left to right a little better. I can open much further. I do have pain on the inside of my mouth, my jaw, my teeth, in this area. And I can't feel here. It's still numb, so, I'll still have food kind of drip there, and my son is always like, oh, you got food or something there. But that's much better, because I did mention that, there's depression that can form, or, like I mentioned, being discouraged, and that can go a long way within your day, within your life. And it was hard with healing and recovery. You don't want to do much. You don't want to get out. It's hard to motivate yourself, and that can hinder your recovery too. So it's not easy to hear. It takes time. But I'm telling you, the time it takes isn't as long as you think. It will happen. It's it is time, and it seems to go by so slow, and every single day you're looking at yourself and you don't see the change. You don't feel the change because your emotions are taking over the way you see it. But I want you to realize that things get better. I had the complications that not everybody does, but here I am 7 months after 4 years of pain and struggle and 4 previous surgeries before a joint replacement. And I never thought that I would be here. So it gets better. The only other thing that I didn't mention yet is because I still have some lingering pain, and I noticed within the past month that when I open and close or eat, I have a clicking and popping. And we're not sure if that has to do with my jaw, or my bite still being off. So when I speak, my jaw kind of goes side to side or not straight up and down. And that's trying to be fixed with the orthodontics, of course. But just in case there's something else going on, we're going to do the arthrocentesis again on both sides. And that will be in 3 weeks. So I'll keep you updated on that. But arthrocentesis, in case you don't know or haven't had it done yet, I did go through it a little bit more in depth in my previous video. But they will go into both sides with a small incision and put in steroids or saline. They'll be able to kind of move things around. This is not with a scope where they can see and then move the disc if they need to. But my surgeon does have my permission, I guess you would say, to do what's necessary. So while he's there, if he feels like something is hindering being able to even inject that, then he would go on to do the next thing. But he said, we do know that the disc on the right side is displaced. So it's a possibility that we'll have to do something to address that. Fingers crossed that we don't. But as of now, I'm very happy. I feel so positive about where I am from where I started, like I said. And a lot of people have asked questions about how much research I did and how I feel emotionally and things like that. So I just want to answer those questions. And then please, if you have any other questions, feel free to ask. Because it helps me too. This has been sort of a therapy for me. You don't really have an outlet because it's not like you meet someone every day that is going through something like this. So if you have questions or just want to mention something, or if there's information you have for me, I would love to hear it. But to answer the question about emotions, I sort of did touch on it a second ago, but in the beginning it was tough. I trusted my doctor and was excited to start the process, to have it done, to have the surgery. But I was scared. I didn't know what to expect, and I couldn't find a lot of information. I didn't know anyone. The things I read were the basics. I couldn't find any blogs, any videos, anything that showed someone really telling me what to expect. But I just went in blind. I just let it happen. And because of that, a lot of things were not expected, and it made me more scared. It made me, like I said, depressed and alone. It sounds strange to say because I did have my family and I had support, but I felt alone. I felt angry, and I didn't see any change. Like I said, I saw myself every single day in the mirror. I didn't see any change, and that was hard. The only thing is that I pushed myself and pushed myself to be able to get a wider opening, and that helped. It really helped because that's something I could see. That's something that I was measuring. And to do something like this helped. So write it down. Do a diary. If you don't want to do a video, take pictures. Keep track of your progress, because then you can look back, even if it's every week. because there will be change. You don't see it, but there will be change. And as far as research goes, I couldn't find much, but I just knew how the surgery would go. I knew the process. So that's the only thing I could prepare myself for. One other thing I want to add is that when I went to see my surgeon 10 days after the surgery, it was the worst visit. It was the worst pain. He explained that it was necessary, but it was horrible. Basically, he forced my opening. And it's mainly because my body heals in a very strange way. He said he's never had a patient that formed scar tissue so quickly. So in the first 3 days where I was in the hospital, I could only open a very small amount, and I had bands on, which only allowed me to open less than the size of my thumb. So when I went to his office, he basically forced 3 times the amount of that opening. And when I say painful, I mean screaming. He having to close the door, painful. And not everyone will go through this, but I just wanted to mention that because, like I said, I'm trying to be very open and tell you everything I've gone through. Okay, so anyway, this has been a very long video, and I apologize. If there's anything that I could say that I haven't, or any questions that I can't answer, please let me know, and I hope this has been helpful. Okay, I'll let you know how things go from here.